low. I'd get so high, that's just the way it goes. They don't tell you when you're young how much it sucks to be numb. I'm feeling fine, you know I'm feeling good. I got ya, brought him back to my hood. They don't tell you when you're done how fun it is to get lost. Never forget your place. Try to look up cause the answers are in your face. Never forget to pray. I pray to my God and my mom cause they're both the same. I pray for my homies. I pray for the girls that feel lonely. I pray for you, for me, for everything that's ever come my way. You know at night I pray. You know at night I pray for you. You know I pray for you. You know I pray for you. I'm feeling blue, you know I'm in that mood. Oh, then my 40 on the avenue. They don't tell you when you're young how much it sucks to be numb. I'm feeling big, you know I'm feeling strong. I got ya. He knows all my songs. They don't tell you when you're done how fun it is to get lost. Never forget your place. Try to look up cause the answers are in your face. Never forget to pray. I pray to my God and my mom cause they're both the same.
Enjoy the music. We'll be starting
I
shortly.
pray for cause I feel lonely. I pray for you, for me, for everything that's ever come my way. You know at night I pray. You know at night I pray for you. You know I pray for you. You know I pray for you. Get lost in somebody before the world ends. Grab the first human being you see. Tell them you love them. Get lost in somebody before the shit ends. Grab the first human being you see. Tell them you love them.
Thank you, everyone who've signed on so far. Please spend the last 2 minutes grabbing any water, wine, or anything else you might need for the remainder of the night. We'll begin at 6:05. Thank you. Right?
Remember those walls I built? Well, baby, they're tumbling down. And they didn't even put up a fight. They didn't even make the sound. I found a way to let you in, but I never really had a doubt. Standing in the light of your halo, I got my angel now. It's like I've been awakened. Every rule I had you breaking. It's the risk that I'm taking.
Good evening, everybody. Welcome to today's session. Let's talk about mental health in the Cambodian and Vietnamese communities. Before I continue, we're love to have our interpreters explain how to use the interpretation function. First, I'd like to introduce the Khmer interpreter, Bo Uch.
Yes, hi, ជំរាបសួរអ្នកទាំងអស់គ្នា My name is Bo Uch ខ្ញុំឈ្មោះអ្នកបកប្រែភាសាខ្មែរណាយើងកំពុងផ្ដល់ជូនការបកប្រែផ្ទាល់ភាសាជាភាសាខ្មែរក្នុងពេលប្រជុំនេះប្រសិនបើអស់លោកអ្នកលោកស្រីចង់ស្ដាប់ការបកប្រែជាភាសាខ្មែរសូមចុចប៊ូតុងការបកប្រែភាសាឬក៏ interpretation នៅកញ្ចក់ Zoom ខាងក្រោមផ្នែកខាងស្ដាំឬក៏ Zoom screen អ្នកនឹងមើលឃើញរូបតំណាងសកល a global icon ហើយមើលភាសាខ្មែរគេដាក់ថាខ្មែរប្រសិនបើអ្នកចង់ស្ដាប់តែអ្នកបកប្រែហើយមិនចង់ស្ដាប់ពេលគ្មិនដើមទេសូមចុចបិទសំឡេងវីដេអូដើមគេហៅថា mute original audio ដើម្បីទទួលការបកប្រែភាសាខ្មែរដោយប្រើកម្មវិធី Zoom smartphone app របស់អ្នកសូមចុចលើបន្ថែមទៀតគេហៅថា more ឲ្យចុចចំណុច3ខាងក្រោមនៃជ្រុងខាងស្ដាំនៃកញ្ចក់ screen របស់អ្នកជ្រើសរើសការបកប្រែភាសាគេហៅថា language interpretation ប្រសិនបើអ្នកចង់ស្ដាប់តែអ្នកបកប្រែហើយមិនចង់ស្ដាប់វេគ្មិនដើមទេសូមចុចបិទសំឡេងវីដេអូដើមគេហៅថា mute original audio ចឹងសូមអរគុណ
Thank you, Bo. I'd like to have the Vietnamese interpreter, Nguyen Yimni.
Xin chào quý vị. Chúng tôi cung cấp dịch vụ thông dịch tiếng Việt trực tiếp trong buổi hội thảo này. Nếu quý vị muốn nghe tiếng Việt, xin vui lòng bấm vào nút Interpretation, nghĩa là thông dịch, ở góc dưới bên phải màn hình Zoom của quý vị. Quý vị sẽ thấy biểu tượng trái đất và chọn Vietnamese là tiếng Việt. Nếu quý vị chỉ muốn nghe tiếng của thông dịch viên và không nghe tiếng người phát biểu, hãy nhớ bấm vào nút Mute Original Audio. Để nghe lời phát biểu của ban chủ trì cuộc họp bằng tiếng Anh, xin vui lòng giữ nguyên mặc định off. Để nghe tiếng Việt qua Zoom trên app của điện thoại thông minh, xin vui lòng bấm vào nút More hoặc dấu 3 chấm ở góc bên phải, phía dưới màn hình của quý vị. Chọn Language Interpretation là ngôn ngữ được phiên dịch, sau đó chọn Vietnamese và bấm nút Done. Nếu quý vị chỉ muốn nghe tiếng của thông dịch viên và không nghe tiếng người phát biểu, xin nhắc lại hãy nhớ bấm vào nút Mute Original Audio. Xin cảm ơn.
Thank you, Nguyen. Thank you, Nguyen and Bo, for providing that. My name is Hieu Nguyen, and I will be one of your moderator today. I am part of Viet Rainbow of Orange County and have been working on this reporting by Agnes and the TimesOC for the last several months now. And so without further ado, I want to introduce you to my co-moderator, Agnes.
Hi, everyone. Thank you so much for being here this evening. We know the presidential debate is also happening right now. So we just really appreciate you taking time to be here at this forum to discuss a very important topic. My name is Agnes Constante, and I'm a freelance reporter for TimesOC, which is a community paper under the LA Times. And I recently wrote a series for TimesOC under a fellowship from USC Annenberg Center for Health Journalism about the lack of culturally sensitive healthcare in Orange County's Cambodian and Vietnamese communities.
Thank you, Agnes. And many of us have been attending Zoom meetings, but not necessarily Zoom webinars. So for those who haven't been attending webinars, just want to take some moment to explain the difference between the chat function and the Q&A function. You can use the chat function to share reactions, resources, and or connect with each other. If you're trying to share something in the chat, notice that you can message all panelists and all attendees or someone privately. Make sure you're sending your message to the right person or group. So if I'm not doing too good as a moderator, please don't, you know, just make sure you communicate with the person you communicate that to, and not everybody, unless you want that to happen. And then for the Q&A, please use that function to ask panelists questions. I'd like to take some time to go over the agenda for tonight. First, Agnes will talk about her reporting process and what she found. Then Agnes and I will be moderating a roundtable discussions with community stakeholders. We'll leave time at the end for Q&A. You can feel free to ask questions throughout the event, but we'll get to answering them at the end. I'm going to pass the mic over to Agnes to give you a presentation on her reporting and what she found.
Thank you, Hieu. So we're hosting this forum today to culminate a series that I wrote for TimesOC about the lack of culturally sensitive healthcare in Orange County's Cambodian and Vietnamese communities. And I just wanted to take some time just to share how that series came about and to highlight some of the findings that came up in the reporting process. So I've been a freelance journalist for about 4.5 years, and one of the outlets that I contribute pretty regularly to is NBC Asian America, where one of the topics I've been able to cover a little bit more in depth than others is immigration in the Southeast Asian American community. So being able to report about that issue is really what sparked my interest in writing a story about healthcare access in these communities. So I pitched a story to TimesOC late last year, and I actually had pitched just a single story, but when I found out about USC's Health Journalism Fellowship, I decided to see if they would be interested in supporting a series of stories that took that topic and looked at it a little bit more in depth, and fortunately they were. So the series ended up being 3 stories long, and each one focused on a different topic under this umbrella topic of improving healthcare. The first one focused on physical healthcare, the second focused on mental healthcare, and the third focused on efforts to reduce that disparity and to address the lack of culturally sensitive care. For those of you who maybe haven't had a chance to read the series but might be interested, there's a link here on this slide, and you can feel free to screenshot it so that you can read it whenever you have the time to. So I also wanted to take some time to talk about what came up in the reporting process, and I wanted to start off with the story on physical healthcare. So this story focused a little bit more on the Cambodian community, and so there were 3 main barriers that I wanted to highlight. The first one is language, and this is a big one because about 90% of Southeast Asian Americans speak a language other than English at home, and 45% have limited English proficiency. So to bridge that language gap between health providers and patients, providers will use interpreters so that they're able to communicate. There are 2 entities in the United States that certify medical interpreters. One is the National Board of Certified Medical Interpreters, and the other is the Certification Commission for Healthcare Interpreters. So the board offers a total of 6 target languages in which it offers certifications, and that includes Vietnamese. So it has a total of 31 Vietnamese interpreters, and 15 of those are based in California. There are no Khmer interpreters certified under the board because it's not a target language. Although this year the board did expand so that it could offer credentials to interpreters who don't speak one of the 6 target languages. So people who speak Khmer and want to get a credential in medical interpreting from the board can do that, but as of now, there are still no certified or no credentialed Khmer interpreters. The second entity that offers certification in medical interpreting is one that offers certifications in more languages than the board does. It has a total of 6 Khmer interpreters. None of them are based in California. They're based in Washington, Minnesota, and Massachusetts. And it also has 99 certified Vietnamese interpreters. So it's also just important to keep in mind again that these interpreters serve the Cambodian and Vietnamese populations across the United States. So there's a real shortage in medical interpreters. The second barrier that came up with physical healthcare access is education. So one of the biggest things is that there's a lack of awareness when it comes to preventive care. So the Cambodian Family, which is a nonprofit organization based in Santa Ana, is working to address this through programs that it holds, including workshops on preventive health practices, also health education workshops about conditions that are prevalent in the community. So some of the workshops it offers covers topics like health disease, stroke, and breast health. And a third barrier that came up in physical healthcare access is transportation. And there are a couple of layers to this. One is that Cambodian elders don't want to ask their children or burden them with having to take them to doctor's appointments. They would rather go to an agency like the Cambodian Family who they trust and have them take them to the doctor. And the problem with this is that there's not enough staff to provide the transportation needs for the whole community. In the 2010 census, it stated that there were about 7,000 Cambodian residents in Orange County. So that's quite a bit of people for an agency like the Cambodian Family to serve. So there are actually transportation services available to Medi-Cal patients through CalOptima, which is an agency in Orange County. And the agency also offers language lines that are available for people who are limited English proficient. So they do offer language lines in Khmer. But the issue with that is even saying something as brief as Khmer interpreter, which you would need to say to request for that interpreter, that can be uncomfortable for Cambodian patients. So that discomfort is a barrier when it comes to accessing these available transportation services. For the second story in the series, which covered mental health care, I was able to receive community engagement support, which allowed the community to really help shape the reporting. It allowed my editors and I to do some deep listening through a series of listening sessions, and we were able to hold 4 of them with providers and with community members. And I just would like to take some time to acknowledge Danielle Fox, who is the engagement editor at USC's Center for Health Journalism. She was very instrumental in organizing and holding these sessions. And these sessions were very, very important, and they're actually a big part of the reason that we're holding this forum today and centering it around mental health, because it was expressed in those sessions that a forum to wrap up this series would be helpful. And it was also just really important for us to listen, not only to what would be important to include in the story, but also to what would be helpful to take this reporting a step further. As far as barriers go for mental health care access, the underlying theme throughout this story was that it's a lack of bilingual and bicultural providers that are the main barrier to why people can't access the mental health care that they need. So there are a couple of really important nuances that not enough providers understand so that they can effectively serve the Cambodian and Vietnamese communities. For example, not enough providers understand the refugee experience, what it was like for refugees to flee the Vietnam War, what it was like to flee on boat and to not know how long they were going to be on a boat at sea. There also are not enough providers who understand what it was like to be under the Khmer Rouge regime in Cambodia, what it was like to flee. Under the regime, about 2 million Cambodians died. So as a result of these experiences, PTSD is very common in both of these communities. And then there's also intergenerational trauma. Not enough providers understand what that looks like for the Cambodian and Vietnamese communities, and how the trauma that refugees experience can be passed down to their children and even their grandchildren. And then there's also the intersection of cultural and gender identity. So there also are not enough providers who understand what it's like to live at the intersection of being Vietnamese and LGBTQ, or being Cambodian and LGBTQ. And so for the final and third story in the series, it took a look at the efforts to address the lack of culturally sensitive care. And there are actually quite a number of things that are being done, but I'm going to focus on a couple here. So the first is health navigators, and they serve as a really important bridge to between patients and providers, because they help patients navigate the healthcare system. So this is a big piece for folks at the Cambodian Family. They have 9 health navigators who serve multiple roles. They serve as interpreters, they help patients fill out medical forms, They bring them to appointments, they serve as case managers. So they are very, very crucial in bridging that gap so that the community members can access healthcare. Another important effort is partnerships between government agencies and community-based organizations. In Orange County, the OC Healthcare Agency partners with community-based groups like the Cambodian family to make sure that the community receives translated materials. Since the Cambodian population in Orange County is at around 7,000, that doesn't meet the threshold that's needed to receive translated materials. So these partnerships between government agencies and community-based groups helps ensure that communities get the information they need so that they can get the healthcare access they need. And on a legislative level, in California, many community groups advocated for a bill called AB 512, and that would have increased accountability for cultural competency in mental health services for groups, including communities of color, the LGBTQ community, and the undocumented. The bill, unfortunately, was vetoed last year by Governor Newsom, who said in his veto message that he supported the bill, but he was concerned about funding. The California Reducing Disparities Project is also another important effort that I wanted to highlight. The project is funding 35 organizations to conduct and evaluate community-defined mental health practices. And one of the groups that's received a grant from the project is the Cambodian Advocacy Collaborative. It's an association of 5 organizations in Southern California, which includes the Cambodian Association of America, the Cambodian Family, United Cambodian Community, Families in Good Health, and the Khmer Parent Association. And so the project that they're carrying out now to evaluate these practices is still currently ongoing. But even at this point, they've already seen some promising results. One of their preliminary findings is that about 60% of participants reported a reduction in past traumas. Another important piece is bringing providers to patients, and this is a solution that addresses transportation barriers. And it's something that the health group 360 Healthcare does. 360 Healthcare caters to the geriatric population. Its providers are Vietnamese, and the majority of its patients are also Vietnamese. So having the providers come to a patient's home has been helpful, because for elders to visit a clinic or hospital, oftentimes that can require them to have their children take time off work to take them to the doctor, and that can put a strain on their income. So getting rid of that barrier by having providers come to patients has been helpful in ensuring that elderly are able to access healthcare. And the last effort I wanted to highlight was a youth-led campaign for a wellness center, and that actually came out of an organization in Long Beach called Khmer Girls in Action. So Long Beach is not in Orange County, it's in LA County, but we wanted to highlight them because Long Beach is home to about 20,000 Cambodian residents, and it's also not too far from Orange County. So in 2015, the organization spearheaded a youth-led campaign for a wellness center across Poly High School, which is where most of their youth attended high school. And this initiative came out of a 2011 survey based on results from 500 Long Beach youth, who said that some of the things they were experiencing was racial profiling. They also knew people who were deported. And so based on those survey findings, they decided that it would be helpful to establish a community wellness center, and they were able to do that the following year. So that was also an important effort to bring healthcare access to Cambodian youth. And on that note, I think talking about these efforts is a good place for us to segue into the discussion with our panelists today, again, which is meant to facilitate a talk about what are some of the next steps that we can take when it comes to improving healthcare access in Orange County's Cambodian and Vietnamese communities. And I just wanted to introduce the panelists that we have here with us today. We have Amina Sen-Matthews, whose pronouns are she, her, and hers. Amina is the Health and Mental Health Program Director of the Cambodian family. We have Dr. Clayton Chau, whose pronouns are he, him, his. Dr. Chau is the director of the Orange County Healthcare Agency. We have Dr. Edwin Poon, whose pronouns are he, him, his, and Dr. Poon is the director of Behavioral Health Services Integration at CalOptima. We have Marianne Fu, whose pronouns are she, her, hers. Marianne is the founder and executive director of the Orange County Asian and Pacific Islander Community Alliance. We have Hieu Nguyen, whose pronouns are she, they, he. May is the project manager at Viet Rainbow of Orange County, who is co-hosting this event with us this evening. And we have Paul Hoang, whose pronouns are he, him, his. And Paul is the founder and former president of Viet-C.A.R.E and the founder and CEO of Moving Forward Psychological Institute. And so at this point, I just wanted to just note that it was really invaluable for us to hear about community members' stories in the reporting process. And we recognize how important it is to hear their voices and stories. So I was wondering if you could share how people's mental health stories influence your current role or the industry you're in. And Dr. Chau, let's start with you.
Hi, good evening, everyone. First of all, I want to thank everybody for taking the time out of your evening hours to join us on this important conversation. And certainly, Agnes, thank you so much for the work that you've done. I think it's really important, first of all, to drive policy and influence policy. So I would love to connect with you to have a conversation, at least from my perspective as the healthcare agency director for Orange County Healthcare Agency here, to inform us in our policy making process as is related to access to care and addressing the inequity in our vulnerable population. And certainly when you look at the Cambodian and the Vietnamese American community here in Orange County, there is a really strong disparity and inequity when it comes to overall healthcare, particularly on the mental health care. I think the reason why I chose mental health as the area of medicine to go in is, first and foremost, I think most of you who know me, I've been very public about my own journey in recovery for my own chronic depression and PTSD diagnosis, which related to childhood and youth trauma. As some of you may know, or old enough to know, I'm the boat people generation that came to America due to the Vietnam War. And so early on in my life, personal life as well as professional life, certainly I have encountered a lot of people, particularly refugee and immigrants from other countries in their process, in their journey of coming to America, have encountered trauma, and it depicted through the expressions of mood changes, anxiety, as well as re-traumatized through the process of acculturations into this what we call salad bowl of the U.S. And so it really piqued my curiosity on how can I do, what can I do as a physician in first treating, of course, diagnosing and treating folks appropriately, especially people who have post-traumatic stress disorder, but certainly changing into an administrative role is wanting to make an impact in the decision-making process as well as policy as is related to healthcare, access to care, access to quality of care, and certainly access to appropriate and inclusive care for individuals who from different culture and who especially have English as the limited proficiency in terms of barrier to care. So that's where I came from, and hopefully can contribute to the process of really reduce stigma as related to mental health, improve access to overall care, and certainly reduce and hopefully eliminate inequality as is related to healthcare.
Thank you, Dr. Chau. Dr. Poon, would you like to go next?
Sure. Thank you so much again for inviting me to participate in this very important discussion. So I read through the stories, all three of them, the articles that you put together with many stories. There are really several themes that really resonate with me. First of all, I think all the stories are very powerful. Story really speaks to the hardship and the challenges of immigrants coming to this country. And myself as an immigrant, I really at times really connect with their journey and their experience. And I find that there's a lot of courage and determinations in all of these stories too. And that's really the spirits that really also resonate with me deeply. But kind of similar to Dr. Chau's comment, I think one of the themes that I've noticed is really the trauma that they endure before they came to this country, and the experience that they've had and that they described, with the healthcare system and the re-traumatization. And I think, as a psychologist, but also now working administratively, it's really important that I feel very passionate about that there's an importance that for those of us who are in the administrative role to really work on improving our system to make sure that we do not re-traumatize people and that we support trauma-informed care. And one of the things that I'm really passionate about, and we have our first, California has a first Surgeon General, Dr. Nadine Burke-Harris, who's been champion for adverse childhood experience screening and to really focuses on trauma-informed care. And I really feel very passionate about making sure that our healthcare system do pay attention to trauma and making sure that all providers are really sensitive and trained to understand the impact on trauma on how we provide, how people access care. So that's really important to me. And then the other components that I really, sort of connected to is the access piece. And I don't think it's just an access to services provider who speak the language. We know that language is just one component of cultural sensitivity and cultural awareness. And I think it's really important to make sure that we look at access to quality healthcare, healthcare that's, provide equity, equality and justice, sort of that those principles I think are very important. So those are some of the thoughts that I have, so.
Okay, thank you so much, Dr. Poon. Marianne, would you like to share how people's mental health stories influence your role or the industry you're in?
Yes, I think just in hearing stories, and I'll give you an example, there was a woman right now for COVID-19, the community is really impacted. We had a woman who owned a business and she had wanted to commit suicide. She was severely depressed because of the impact of COVID on her business and losing so much wages. And she was the main supporter of her family. And in seeing that, we provided support and mental health support. But what really I saw was the need to get all sectors involved. So it was important to get, the business sector and the Vietnamese Chamber of Commerce involved. It was important to get other healthcare providers and the school district for her children involved. And so through all of these stories, you see it's not just about individual wellness and behavior health and mental health. It's about making sure that we can integrate wellness and mental health into all systems and that we're inclusive of all that. And I see it in so many stories right now, the anti-Asian American hate that stems from some of the issues with COVID and some of the blame. We're seeing a lot of youth who are severely depressed or feeling like they're targeted, and working with not only them to make sure to get the care they need and the support they need because of this trauma, but also to get their schools involved, to get policymakers involved about not calling it the China virus, to getting multiple, systems involved about changing things and making sure that we're not re-traumatizing people, we're not causing pain and anxiety and stress. And so just through the stories, you can see it's not just about individuals, it's not just about families, it's about changing policy, it's about changing systems and having multi-layers involved. And I think what's great is that, we get funded through the Orange County Healthcare Agency for our mental health and wellness, and that they really saw that. They saw, let's remove some of the anxiety and stress. Let's help with rental assistance, or let's help with transportation. Let's think about all of the barriers to wellness. Let's think about what is causing some of the root causes of these issues, and let's bring in other people as well. Let's create a team approach and not just individualized care. So those are the lessons I learned from a lot of the stories that we hear on a daily basis.
Yeah, great. Thank you so much, Marianne, and thank you for sharing a specific example. I think that's really helpful in kind of understanding how that, had an impact on you and Okapaka. I'd also just like to throw this question out to Amina as well.
Thank you, Agnes. First off, I want to thank everybody for being here tonight, especially on the election debate and choosing to be here with us tonight to really listen to our stories. I just want to again introduce myself. I'm Amina Sen-Matthews. I'm the program director here at the Cambodian Family. For those of you guys who are not familiar with the Cambodian Family, we are a nonprofit agency in Santa Ana. We've been around since 1980. We just celebrated our 40th anniversary, so we're really proud of that. Unfortunately, we weren't able to celebrate it in person, but hopefully next year we are able to get together and celebrate all the wonderful work that we've done. So I wanted to just kind of mention that the article that you've written, Agnes, really resonated with me because, I am a child of refugee. My parents came here and sacrificed a lot in the early 80s. They were monolingual. They were, and they had so many struggles. And their stories of how they overcame these struggles just kind of resonates with me on an everyday basis. At the time when I was a young child, I was the translator for my parents when they went to the doctor, or when the teacher needed to talk to my parents. I had to translate all that. So working at the Cambodian Family, when I hear our client's story and they tell the same story of their own struggle of going to the doctor or seeking medical attention. So, we serve 30 to 40% of our participants are older adult, and I see my parents in every one of them. So we work continuously, my team and I work continuously to make sure that all of the community members that we serve have access to health and mental health care. Thank you.
Thank you, Amina. May, would you like to also offer a response to the question?
Yes, thank you so much. And I just want to say how it's such a blessing to be on a panel with such amazing change maker and innovators and leaders in Orange County. I just want to pitch in the sense of what, a part of this story, right? I think as I myself have a personal story to mental health, being heavily impacted and really seeing how the mental health system does not, traditionally serve, our ethnic communities, or traditionally serves the LGBTQ community. I also want to talk about like the community or the social piece to it, right? At the Rainbow of Orange County, we're navigating not only the traumas that comes within our Vietnamese American community, but we're also navigating the identity, our LGBTQ community, right? And our LGBTQ identity. And I think one of the biggest pieces that these stories does create a huge impact in our work, specifically with youth, right? We work with youth that is still, looking to figure themselves out, to find themselves in an environment that isn't traditionally welcoming, right? And so I think, within these stories, it's very important for us to really center our youth and our youth stories around this. One of the things I want to share is that, in our youth program, right, we have youth that shared with us, where prior to COVID, they had support groups, they had, social groups that they would be able to hang out with and connect. And I clearly remember one of the youth sharing with me how, our program is, the only space right now that they have where they feel safe to share their opinions and their emotions, right? And so I think, in part is, us centering, when we're talking about youth, or when you're talking about, leaders and nurturing our young leaders, at VROC, we really stress the holisticness, right? We cannot nurture our future leaders without really, centering emotional safe, environment, without centering a space for them to explore it.
Thank you so much, May. I think we're going to go ahead and move on to the second question. So I'm going to pass the mic virtually to Hieu.
Thank you, Agnes, and thank you all the panelists for answering that question. So my second question is around, in the articles and throughout the different community listening sessions that we held, the common theme was that there's still inadequacies in terms of culturally competent and culturally responsive care. One of the main disparities highlighted in the series is the lack of bicultural and bilingual providers who can serve Cambodian and Vietnamese community members. My question to Amina, Paul, and me is, how can we address health equity issues of APIs, specifically the Cambodian and Vietnamese communities in OC? We'll start with Amina.
Thank you, Hieu, for the question. I just want to mention first off, like in Orange County, that's a really big issue for us here in Santa Ana. When I came into this field, we found out that there was only one Khmer-speaking doctor in Orange County, and that doctor works in Anaheim. So if you can imagine a 60-year-old Cambodian community member who's monolingual, who does not have transportation, having to find this doctor, get on a bus, a 3 to 4 bus, just to go out there and see this doctor. This is a challenge. This is a big challenge, and this is something that we're always striving to address here at the Cambodian Family Community Center. As Fatana, who is our executive director, mentioned in the article, the lack of Cambodian providers is a difficult issue to address because it requires efforts to ensure that the community obtains a higher education. As Agnes wrote in her article, there's only 17% of Cambodians who've obtained a bachelor's degree or higher, compared to 31% of the total population. So what we want to do and how we want to address health equity issue is to really, encourage our younger generation to go into the field of mental health, i.e. being a social worker, family, marriage and family therapist, psychologist, psychiatrist. However, it's not possible if we don't have a vigorous and intentional program that builds a pipeline for the Cambodian and other Southeast Asian youth, from high school. You want to talk to them at a young age about becoming a mental health professional, in high school, even middle school, high school on to the college and then to a career pipeline. And we want to, once they obtain these degrees, we want to encourage our, public and private institution like the Orange County Healthcare Agency, Orange County Service Agency, and others to really intentionally seek out and hire more Cambodian Vietnamese population, so that they're able to speak the language and they are able to understand the culture. And we can't wait that long for, our youth to become, marriage and family therapists or the seniors. So we know that that's a long-term goal. So as you know, our members, are getting older, so we can't wait for this to happen. So one of the ways TCF addressed this issue of inequality is to really utilize our bilingual and bicultural navigators. We have 9 of them here at the center. These bilingual health navigators play a really crucial role into helping our community members get access to both health and mental health care. And then I also wanted another thing to address health equity is to utilize our existing resources by partnering up with CBOs like ours, the Cambodian Family, or CAPICA, MECA, or the Viet Rainbow, who are already trusted members in the community. They are already, community members are already coming to us seeking services. So, and we're already working in the front line. So these are just some examples of ways that we can address health equity in the community. Thank you.
Thank you, Amina. And how many Khmer doctors are there now in OC?
We know of one. One. And when we talk about mental health specialists or even therapists, in one of our program, our Body, Mind, and Spiritual Wellness program, we said that we were going to hire one Khmer speaking therapist. Hieu, it took us 1 year to find a Khmer speaking therapist, and we finally found him, Mr. Lee, and he came on board part-time, and he has over 40 caseload right now. And especially during the pandemic, there's more, referrals coming in from the communities because they want to be able to speak to someone in their own native tongue who looks like them, who understands the culture, understands the different family dynamics. So, he has a full caseload. His clients are individual. He's seeing individual clients, married clients, couples, families. We're actually seeing an increase in family therapy because we know, there's the intergenerational trauma that's happening a lot in our communities. So he's seeing a lot of family members coming into our program as well.
Yeah, so not much has changed in terms of Khmer providers in the community. Thank you, Amina, for sharing that. And so, Paul, besides the workforce development, having bilingual and bicultural navigators and partnering with trusted community leaders, how else can we address health equities within APIs, specifically the Cambodian and Vietnamese communities in Orange County?
From my experience, mainly drawn a lot on community organizing, on crisis services. And just a quick note with Amina's response earlier, in the past, about 20 years ago, when I was living in Chicago, I was the only Vietnamese speaking clinicians in the state. And so people were driving 5-6 hours away for services. And that was another reason why I moved back to California to OC for that support, because as a clinician, imagine Chandara or Lee, as being the only Khmer speaking clinicians, the level of clinical support is not there for case consultation, those kind of stuff. For the community level to address this is something I've been working on for over 20 years for cultural competency and responsive care. We have to look at it in the 3 levels. First is the micro level. On the individual level, as a community members or as the clinicians, just because we have a Vietnamese last name or a Cambodian last name does not mean we are culturally competent or responsive working with the individuals in front of us. So it's important to practice cultural humility, meaning that we have to be able to allow the person we're working with to be the expert of their experience and be students in that moment to learn and allow that person to be able to teach and share with us his or her stories so that we can work with that. So that's on the individual level. The other part that we need to work with on the individual level is our own biases, our own struggle because of our value and cultural value of not disturbing the peace, not to rock the boat as Asian American or as Asian, those who traditionally, insofar as in Asian cultures, to not rock the boat. In this society, especially in the Western society, if we don't speak up, we have no voice. And so it's crucial for us as Asian community on the individual level to advocate for ourselves, to advocate for services, to advocate for resources. And then on the meso level, the community level, that's where that's important part of the advocacy, the collaborative partnership come together. Put aside our differences, come together with the common goals of increasing resources for all. And then on a macro level, and this is where Dr. Poon, Dr. Clayton, and others on the macro level and so forth, on a policy level, how do we create policies that recruit, incentivize providers to go into the field, right? And so if we go not just Medi-Cal, but go on general with the health insurance panel and you search for a Vietnamese speaking therapist, not very many. And if you look for Khmer, there's gonna be only one, which in there, right? But and not all of us are on insurance panel, and not everybody is qualified to go to county services and on an insurance panel to be able to get services. So oftentimes, even though they have insurance, they still have to pay out of pocket. And that's another barrier for them to get services. So this is something that Orange County is working, and I am a firm believer and supporter of the system transformation, the behavioral system transformation, where there is that payer, one source idea. Doesn't matter, there's no wrong door. If anybody can come in, regardless of payment or funding source, and then they can get the services they need, I think that's one of the huge barriers that we can remove, especially for our community members. The other part is that we have to have centers in a community that is culturally appropriate. Most Asians are going to go to a brick and mortar building that's not culturally relevant to them. There's a program in Fresno County with a Hmong community where they have a cultural healing center, and they design it in a way that's culturally relevant and appropriate. And people naturally drawn there as a community center to do their activities, but also to get healing and services. So I think we need to incorporate into the infrastructure of designing buildings, not just going to a building that's just so cold and not really culturally inviting. And so that's a part where I think, to sum up, is the importance for advocacy, for empowerment and education, for collaboration and partnership. And I think to be able to come together as a community to identify a shared vision, a focus that we can invest our energy and our resources into to work together.
Thank you, Paul, for giving us that quick lesson, social work lesson on micro, meso, and macro. Me, I want to give you an opportunity to share your thoughts.
Yeah, wow. That's really hard to follow up with such great leadership. Definitely agree. I want to re-highlight what Marianne Fu said, right? We can't do this alone. It can't be linearly approached, right? And so I think, for me, I believe, within our community, we've experienced unique trauma, war, poverty, racism, isolation, right? And I think, drawing from my experiences, that, I see the traditional approach to mental health has been medical and spiritual practice, organized religion. And so, I see it in a sense that it's pretty isolating to someone like myself who already felt isolated. I see these moments where I would go to a counselor who, is Vietnamese, but don't quite understand my LGBTQ experience. Or I would go to church who, unfortunately would preach certain issue, right? Against my own identity. And I think the only thing that I would like to incorporate, and I'm gonna be quite bold here, but funding for social groups, social advocacy groups, right? Funding for ethnic organization, that works with the community, and I think the biggest piece to my mental health was, growing up in Kansas City, Missouri, there wasn't a big Vietnamese population and there wasn't a big LGBTQ population. And moving to Orange County, one of the pivotal moments in my life, my personal life and my mental health was, seeing and understanding what V-Rock was. I remember meeting the co-founder at V-Rock and having lunch with him, and just having that one lunch conversation, sharing my story, my mental health story, right? Really lifted a lot of the stressors that I had, and that stressor was no one could understand me. There isn't a place that would understand me. And you know, and I think that's why community members go to trusted organizations, groups, space like the Cambodian family, like VROC, to seek help, because, you know, that's the space where we feel safe. That's a space where we felt like, you know, we can be ourselves and really open up to the struggles that we have. And so, you know, the only thing I would add is please more funding, because we cannot, you know, we cannot continue forward without the support of, you know, of the bigger system, right? And so, yeah.
Be bold, me. Be bold. Ask. But I wanted to give an opportunity to see if Dr. Mary Ann, Dr. Chau, or Dr. Poon have anything to add to that question of how can we address health equity issues of APIs, specifically the Cambodian and Vietnamese communities.
If I may just really quickly, you know, one thing, I think these are just fantastic ideas and comment. I totally appreciate your bold idea. And I think that, you know, your idea really also, it's really about, you know, how do we really maximize our resources, right? Looking at, because we have limited availability in terms of therapists, counselor, but how do we really reach more people with the resources that we have? And so, you know, it's a bold idea, but it is an important idea. And I think that to me, we know the immediacy and the urgency, and we kind of have to look at sort of what can we do now, but it's also a marathon. We need to invest in our community. You know, we know that if we provide opportunity for people to develop the training, to develop their education and embed themselves in the community, that's when you have people who's going to establish roots here in our community, and we'll be able to support our community in the long run. So I really, you know, one of the things that when the state implemented behavioral health for managed care plan for CalOptima, one of the things I really embraced is the fact that we support providing services through interns and trainees, because these are the people that if they experience how they work with our safety net populations, our Medi-Cal members, they invested their career in serving these populations, they're more likely to really, you know, invest their career in supporting us. And I really value those relationships and fosters those opportunities for us to nourish, you know, their career choices and their investment in the community. And that's really where we're going to get the yield that you know, that we're looking for. So.
And how do we also find opportunities to pay sort of mental health interns, because typically they're not. So
well, you know, we do. So that's the thing, you know, so we do support interns. So actually, you know, DHCS does allow CalOptima to reimburse services to interns. So I think that's a really important distinction for us, and we definitely would always look for opportunities to really collaborate with agencies who are looking for those partnerships so that they can support their funding, their opportunity to build their program. Because you know we all know that finance you know really do support services, and so definitely something that it is a challenge, but we can do it as a community.
Thank you.
If I may.
Yes, Dr. Chau. Oh, he froze up. Dr. Chau, you're frozen. Your mouth is open, but it's frozen. So I'll give.
Oh, there he goes.
Oh, Dr. Chau, you were frozen. So if you can repeat.
Oh, yes. I was just going to quickly mention that one of the areas that we really have to address, and that is the sustainability issue of the healthcare system, right? The way we're going, not that we don't have enough funding in the system, but I think that the system has been so insufficient. And so the system is insufficient because we have so many tugs and pulls, so many pilot specialized program that at the end, when you divvy up the pie, you're not going to be able to sustain it. And so what it would require is that all the agencies have to come together and work and integrate and find a solution that is most appropriate for the community. I hear it all the time. Entity keeps saying, I don't have funding. I need to have more funding. But the reality is, I think from the larger system perspective, funding has been insufficiently utilized and administered. And we need to come together to find that solution. So sustainability is really, really important.
I just wanted to add in terms of health equity issues and how to address it. One is the diversity of leadership. And I'll give the example of Dr. Chau. It's so great to have someone who's the head of an agency who understands health disparities and health equity, and also coming from his own Southeast Asian background and his own personal history and story. It really helps because when you have leaders like that, or you have people with that experience, it brings it along and uplifts everybody. And so it's been so helpful in every system that I've worked in when there's a leader or a team who really understand what the health equities are, and it just changes and transforms systems.
Thank you so much, Marianne, for answering that question for us. And Agnes, I'll have you ask the last question to our panelists.
Yeah, and I'm really excited to hear from all of our panelists about this, for this question, because again, this is all about improving healthcare access for Cambodian and Vietnamese communities. So the final question is, what are some actionable steps that individuals, organizations, or even the larger system can take to improve mental health care access? And Mai, let's start with you.
Okay. I kind of want to speak on the individual aspect to this, right? I think for individual that isn't in healthcare, I think, once again, I'm very fortunate to be on this panel, but I think it's also about vocalizing and advocating and continue to speak up about access to healthcare, and especially conversation about mental health, right? Sharing your stories, listening to other people's story. But I also want to speak up, I also want to talk about the individuals in healthcare, right? I want to kind of challenge the term access, because I believe that access and quality is interrelated, right? And I see this, all size fit all system, or like the system that's happening within mental health. And I think it's the need for the unique and specific care for, ethnic community, right? Especially culturally sensitive therapists that, are trained and understand on LGBTQ gender identity issues, right? And also, and I think it's about being intentional and taking that extra step to really look at the community that you serve and really ask yourself, what else can I do to make sure that, we're bringing in that access and quality of care together.
Thank you, May. Next, I'd like if we could hear from Paul. And I know that this is something you also addressed in this series. So if maybe you could touch on some of the things that you told me about for the stories as well.
Yeah, and with this, I'd like to also highlight Viet-C.A.R.E. Since I've stepped down, but we have Hieu Nguyen, who's now the current president. Viet-C.A.R.E. has been around for 12 years, all volunteer-based. So for 12 years as volunteers, community members, inspiring and recruiting other volunteers and partners coming together to be able to provide services to the community. And I since I was young, for those who watched the movie Field of Dream, right? I got to visit the actual field when I was in Iowa. But I truly believe in the statement, if you build it, they will come. In the aspect, the needs are already there. For many of us, if we have the capacity to be able to address their needs, we don't need to wait till funding arrive. We can, because we have collective resources, we have human asset, we have human knowledge. So if each of us can donate something, can contribute something, together we create a bigger pool, which then can be a resource for the community. Take for example, with COVID, since it happened, we have started a coalition, a private-public partnership of 9 agencies of volunteers. All of us are volunteers. We are distributing free hot meal, sponsored 100% by the research room. Donated now over 30,000 meal total every weekend to over 500, 600 people in the community, 15 cities in the counties. We didn't wait for funding to arrive. We just come together because we identified there's a need, the urgency is here and now. And so if we can help one person here and now, we can help that person here and now. And so that was what drove us into coming together because we believe that besides funding, greatness funding is sustainability. But even with funding, if the passion is not there, the collaboration is not there, the resource is going to sit there in a pool. And I think that's a power that as leaders, as community leaders, and in the field, we need to inspire people to come. Because when we have intrinsic motivations, we don't need any other external drive to drive us to do what's right or what's needed for the community. And I think that's one of the ways to address on a community level or on an individual level is to continue to inspire and bring people to come together to address the needs.
Thank you, Paul. Before we move on to the next panelist, I just wanted to remind everybody that's tuning in that if you have any questions, you can feel free to type that into the Q&A, and we're going to take some time after hearing from our panelists to just go through those questions and have them answer it. So next, Marianne, would you like to respond about what are some actionable steps, I guess maybe organizations can take to improve mental health care access?
I think one of the things that we've been doing is partnering up with the universities and their mental health programs, their social work programs, as well as their MFT programs, and really giving support to students to be able to be trained in mental health. Also working with young people to see this as a health career and an opportunity, you know, to really think about this as a you know, something that they would be very interested in going into. We also really want to support consumers to be involved. And this is a part of the Mental Health Services Act that's very important, is the involvement of consumers who have gone through mental health services, who've gone through systems, and getting their advice on how to make improvements, how to design programs, and use them as advisors, as employees. And that's been really great. And then finally, really integrating and seeing culture as a strength. Many times we blame culture, but our culture, our Asian and Pacific Islander and our Southeast Asian culture is so strong, and it builds resiliency. And we have to remember that, and integrating culture as a celebration and as a part of our own healthcare and wellness.
Thank you, Marianne. Amina, could you also offer some actionable steps that individuals, organizations, or the larger system could take to improve mental health care access?
Yes, I can. Thank you, Agnes. For what are some actionable steps we can do at an individual level is really to normalize the language around mental health. We want to destigmatize mental health, because in our community, when we talk about mental health, it has such a negative connotation sometimes. So we want to be able to really just kind of normalize the language, when letting them know that it's okay not to be okay. It's okay to say, I'm not feeling well. I feel depressed today, or I feel anxious, and then also, especially during this pandemic, to really reach out to family members and neighbors to check in on them, to make sure that they're doing okay, both physically and mentally. So those are some of the things that we can do at an individual level. At an organizational level, we want to continue to utilize the bilingual, bicultural health navigators, because they are the bridge between our community members and the service providers. We also want to continue to build people's power, which means that we are building the leadership and advocacy skills to empower a client to be an advocate for change, not just for themselves, but for the community that they live in. I want to mention that, we've been, we're really proud actually that we've been able to build a leader amongst our community, our senior community. They've been really active in being at the table to voice their concerns, their needs, and their recommendation at the county level. The TCF agency, we're not only a direct service provider, but we're also community, we're also building our communities to really just be out there and just advocate for their own health and mental health changes. And another thing I wanted to add too, and the last thing here is to continue to, what we do here is to continue to build win-win partnerships. So we have built partnership with the Multi-Ethnic Collaborative of Community Agency, also known as MECA, to really ensure the older adult have access to mental health services. We have partnership with the Orange County Asian and Pacific Islander COVID-19 Task Force to provide outreach and education and testing information for APIs in Orange County. And then we also have built partnership with the what you mentioned in your article with the Cambodian Advocacy Collaborative Agency, which comprised of 5 organizations like the Cambodian Family, CAA, UCC, KPA, and Families in Good Health. This is all for the Community Wellness Program, which is a part of the California Reducing Disparity Project. And in this project really, just to reiterate your article, it's really to uplift the community defined practices. You know, a lot of times, you know, especially at the university level, we're talking about evidence-based practices, but sometimes these evidence-based practices doesn't really work in our community. So we want to uplift what is working in our community, like the water blessing, which is a practice amongst a lot of Cambodian who are Buddhists who believe in past karma. So if they're going through some sort of mental health issue, and you know, they don't necessarily go to a mental health professional. They go to the temple and they meet with the Buddhists and the Buddhist monk who are able to bless them through the water blessing and wash away their bad luck. We know that this is what our community members believe, and we want to have them have access to these as part of the mental health care. Another thing I want to add too is for, you know, CBOs and community centers to really share resources. We work a lot with the Southland Integrated Services. We don't have a clinical directory. We have a therapist who's in need of a clinical director to oversee the work that he does. So we work with Southland Integrated to get to work with Dr. Masuda as a clinical director there to also oversee our therapists here at the Cambodian Family. Thank you.
Thank you so much for sharing all of that, Amina. I appreciate it. And Dr. Chau, I'll pose that question to you about actionable steps, but I'm also wondering if maybe you can, in addition to you know, the comments that you'd like to offer, if you could also talk about maybe some ways that community groups or social advocacy groups can partner with OCHCA or other government agencies.
So I think I alluded to earlier. I alluded to these collaborative that are really happening here in Orange County, and I'm going to use the example of the API COVID task force. The county has recently collaborated with the task force to truly bring testing and education, not only on COVID, but also on other chronic health conditions, the other inequity in healthcare to the community. I think it is difficult for health system, and any health system, private or public, government or not, to really work into a tiny segment of the community because from a funding perspective, you really have to look at the larger bucket of how you divide up the funding. And so data is a very important piece. And so all of these practices, whether it be evidence-based practices or community-defined practices, whatever work that people do, you really have to collect the data and to have a proof that there is a need in the community. This is not just, you know, I think the community need have this need, and therefore I should have that piece of the pie. The pie here meaning finance and resources and what have you, but coming together as a larger entity to really focus, laser focus to the vulnerable community together, bring in resources, braiding the funding together and leveraging each other's resources like Mina was talking about, like Marianne was talking about. That's the only way we can succeed in truly address the disparity and the inequality issue.
Thank you, Dr. Chau. And Dr. Poon, would you also like to respond?
Sure. You know, CalOptima has a very long history and traditions of really working with community-based organizations in many areas, and we participated in events. So we're part of the fabric of this community here in Orange County. But you know what? When I look at the collaborations, I think there's just so much that we can do. You know, one example that I wanted to kind of point out, for example, is that our member materials, we develop a lot of information that we share with our members. You know, often what we sometimes look at is, you know, we develop an English version and then we try to translate it. But, you know, we all know that translating something from English to another language is more than just a pure translations. We really need to look at how this information is really going to be received in the community. Is the material really speak to the community? And I think, Amina, you're talking about, you know, the Cambodian populations there, you know, they think about mental health. It's not necessarily just go to somebody's office and start having, you know, doing therapy. So when you say, hey, you know, therapy is available, what does it really mean to that community? What is it, how is it that they're really getting the help that they need? So I think there's a lot of opportunity for us as CalOptima to continue this conversation and engagement with our community-based organizations who are really serving our members, really supporting our members, and get those feedback so that we're not just really looking at it from the lens of just this sort of traditional view of one size fits all. Hey, this is, you know, we offer mental health services, but what is it that the community is looking for? What kind of resources are that the community is looking for? So I think that these are the opportunities that in front of us that we wanted to embrace.
Great, thank you so much, Dr. Poon. And at this point, I think we're going to go ahead and move on to the Q&A portion. Thank you to everybody who submitted questions in the Q&A, and also for folks who submitted questions as well through the RSVP form. So we're going to move on to that, and I'm going to pass the mic over to Hieu.
Thank you, Agnes. So we have several questions around technology. And so I asked this question, are the digital divide and digital literacy, for example, finding information using telehealth during COVID-19, being able to afford strong enough broadband to access, an issue we're seeing when it comes to healthcare access for Southeast Asian community in Orange County? If so, how are the healthcare agency and community organization addressing this issue of digital divide and digital literacy?
I can answer that. We get funding from the Orange County Healthcare Agency, and during COVID-19, they knew that people would have a digital divide. So they allowed us to utilize our funding to be able to help people, the community members that we're serving, if they weren't able to get a device from their children's school, or if they didn't have children, we would be able to help them by getting them a device. Also working with partners like the cable companies or the phone companies to get them low cost or free internet was also key. And then also training community members how to use Zoom, how to use different telehealth devices that are confidential. And even though it was challenging, we saw a lot of community members learning and being able to access it. It was challenging, but we're seeing more and more, even older adults who may not have utilized telehealth or technology before. I think it's just about taking time and supporting people. We also found that at least one person in the family might have a smart device, a smartphone, and that was the biggest challenge, is having to share one smart device. And so being able to provide resources with other devices and training. But the telehealth has worked really well, actually.
Thank you, Mary. And Dr. Chau, do you want to add anything?
No, I think that we have to pay attention to the stereotyping. Sometimes we ourselves hurt ourselves because of our own stereotyping in our community. And so Marianne gave that remarkable example of technology in the elderly populations. I mean, throughout this last 8 months, my 84-year-old mother connect to her primary care physician and specialist via FaceTime and Skype. And she has to learn how to do it because all of her kids are busy working, and we couldn't take time out to support her, and she had to learn. And I've heard many stories of our senior in the API community have learned to do so. And actually, that's the only way they can connect with their children because they've been so isolated. And so integrating new technology, using the opportunity to provide education and training and get our community truly integrated into a system of care that beyond the physical barriers that we talk about, right? Transportation and what have you. I think we'll be surprised on how resilient, I think Amina talked about how our community are truly, truly resilient and able to learn new way to get connected, to get care and what have you. And so that's the only way we can sustain our own health and we can sustain a system that support everybody. So.
Thank you, Dr. Chau. Anybody else want to add anything regarding the digital divide and how we're using technology to improve access?
I actually want to add some things, Hugh. You know, when we all, when the county shut down and basically had us all move our services online, we thought, gosh, it's going to be so difficult to get our participants who, you know, 30 to 40% of our participants are older adult to get on Zoom or to, you know, to go online to do, you know, teleconferencing and whatnot. And, you know, I remember meeting with my team. I'm like, okay, guys, we're going to have, you know, we're tasked to get all of our community members online. And we're like, how are we going to do that? But we came together, we strategized, and all of the case managers on 10 of them are, you know, we're calling each community members and really educating them on how to, you know, get on Zoom on their phone or on their iPad or laptop if they have any. And then one of our community health navigator created a tutorial video, you know, in Khmer, teaching our community members how to download Zoom, how to mute yourself, how to, you know, all these things. And we never really, you know, we thought, gosh, it's going to be so hard for them. But now we have, you know, we had one of our event, our Drawing Out Stigma event online, and we had over 100 people showed up on Zoom, communicating and engaging in our event. So, you know, when we thought, gosh, we're not going to be able to do it, but when they had to do it and they learned, and now they have a new skill that they can, you know, put under their belt. So,
great example,
right?
But you see how in the beginning our own stereotype truly against us, right?
Right, because we don't think about it. We're like, okay, well, they're not going to be able to do it. It's going to be really hard. But, you know, we said, well, we're just going to do it anyways. And we have to do it if they want to continue to be engaged in our program and services. And they did it. And I mean, I was really proud of all the you know, our staff who were being so patient, because it's going to be, you know, baby steps. But we got this far. And now I'm like, gosh, when the community, when our centers open, can we continue to offer these classes online? We're seeing more of an engagement, you know, with just everybody in our community. Thank you.
I actually want to say that if we think about it, all of us, all of our parents, against all odds, got themselves here. There's nothing else could stop them, honestly.
I would like.
That's so true, Dr. Chau.
Is it okay?
Chau and Amina, we'll give you a piece short. Yep.
Yeah, no, definitely. I just want to pitch it because I think the youth, and I'm saying this from a quotation from the youth, right, is that Facebook is for old people. No offense, but I think the thing that we're addressing is the accessibility, right? Like, you know, our older generations have access to social media, Facebook, you know, and so I think with VROC or Vit Rainbow for Orange County, we're actually making our training accessible on live, just like today, right? Like we're streaming it live on Facebook. So our generations are having access, and I think it's just continuing to innovate new ways to getting that access, right? Stream it live, make it more accessible, and that's what we've been trying to do. But just a little, yeah.
Thank you, May. So, you know, in the last several minutes that we have, it just wanted, this was this event was a hope was like accumulation event for Agnes reporting, but also like a beginning of something for us to continue to have the conversation. So we've had a wonderful conversation tonight, and would hate for it to stop here. So any opportunities or next step that panelists you see that we could consider or think about?
We should have part 2 to this conversation, honestly, and maybe have it on a weekend where more people could join.
Well, I definitely would second that. I think that there's so much to discuss. I mean, I think COVID-19, you know, really shine a light on a lot of the disparity, but it's also looking at opportunities, right? So I think right now we all are really aware, are all talking about opportunities now. So it's no longer just about reactionary. We're really talking about planning for the future, really looking ahead. So I think there's a lot of great ideas. You know, it's going to be a new day. I mean, you know, there's new normal. There's a new way of really looking at how we really manage care, how we really provide services. You know, so I think it's through these type of forums of sharing ideas and really allow us to innovate and continue to improve the system. So I'm all for it.
So besides the, you know, part 2 to this conversation, any other ideas from the other panelists?
I think it's important for each of our agencies to continue to reach to the isolated seniors, especially those who has mental health or physical developmental disabilities, that due to their challenges, they are unable to access their resources. I know that Viet-C.A.R.E and other of our partners in the coalitions has been making phone call to seniors, those who don't have no access to internet or doesn't know how to access it. So actually making phone call and actually making home visit as well when we deliver food. And for our Asian community, food speaks a lot. Right? Through food, they welcome you into the home. Through food, they open up and share stories. And that's a prime example of how culturally appropriate it is for us to do outreach is with food. And especially when it's hot food, prepare ethnic food too. And so I think providing more of those opportunity is important. I know for our coalitions, we are planning several upcoming events, hoping to be free for the community, a community moving forward together, music festival for the community to come, particularly for individuals who have mental health disabilities to attend. And then there are other activities. So I think if we can have a calendar for community events and resources, and I think I would task and I would ask Dr. Clayton Chau to make this a HCA responsibility to have a community calendar where all the different agencies can upload, share, keep alive calendars so community members can be redirected to one centralized place for information. And I think HCA will be a good home to host all of that information.
And I would offer that if you're talking about mental health related event, Be Well OC probably have a better chance to set that up. Hieu, so be on alert. The reason being the Orange County, because of the county IT system, we are only allowed to link to a contracted provider and not non-contracted providers. So, but Be Well should have a solution for everyone.
Yep. Well, with that, thank you all the panelists for your insightful thoughts and sharings tonight. I'm going to pass it on to Agnes to give us some thank you credits as we wrap up this conversation tonight. Thank you again.
Yeah, I'm just going to echo what Hieu just said. Just thank you so much to all of the panelists for taking the time to be here this evening. I think this is such an important topic, and I think it's definitely not discussed enough for Cambodian and Vietnamese communities. So, and also like what you said, the hope is really that this is just the starting point, that the series and this forum is just a starting point for continuing, coverage and continuing dialogue about this issue. So, thank you, Amina, to Mary Ann, Dr. Chau, to Dr. Poon, to Paul and May for offering your insight about mental health care access. I also want to thank everybody that's taken the time again to be here. All the attendees, thank you so much for taking the time to be here. I also want to thank our interpreters who interpreted in Khmer and Vietnamese. I want to thank our Khmer interpreters, Bo Uch and Sina Nu, and our Vietnamese interpreters, Quinn Gibney and Ryan Lay. I also would like to thank Wen Hoang from Viet Rainbow of Orange County, who also was instrumental in helping plan this forum, Ada Seng from the LA Times, Danielle Fox from USC Annenberg Center for Health Journalism, and also Andrew Perez, also from the Center for Health Journalism. And I also wanted to thank TimesOC, Viet Rainbow of Orange County, and USC Annenberg Center for Health Journalism for co-hosting this event. Thank you so much, everybody, and hope you all have a good evening.
Well, thank you, Agnes and Hieu. Great job. Thank you so much.
Yes.
Thank you so much.
Thank you, everybody.
Have a good night.
Have a good night.
Good job, Agnes.
Good job to you.
Danielle.